Okay. Hi,
Hello.
Michelle. So we spoke a little earlier off of camera, and you had mentioned some things that you were open to getting treated with acupuncture and cupping. You've never had acupuncture, right?
No.
Okay, but you did mention you've tried cupping.
Yeah, a bunch of times.
And it works well for you.
Mhm.
You're an avid surfer, and you've been surfing for a few years, and you've noticed that your neck, back, and shoulders have this tightness and this
Yeah.
discomfort that
Mhm.
also goes into your low back.
Yeah.
But along with that, for many years, you've had some trouble with digestive issues like bloating and discomfort and
Yeah.
pain in your tummy. So one main thing is the bloating has been going on for many years since
Yeah.
childhood, right?
Yeah.
And is it basically anything that you eat will kind of cause you to feel gassy and bloated?
Yeah.
Okay.
Mostly just like allergies. Like I have lactose intolerance, and then I have like sensitivities to other, I guess, ingredients, or like I can't have like a lot of raw produce, for instance.
It's got to
It
be
has to.
cooked.
Yes.
Yeah. Okay. Warmer cooked food, which is very common.
Oh,
That's very
okay.
common. Now, along with that, switching over to your neck, shoulder, and back pain, you've been surfing for many years, and you off camera when you mentioned you're kind of paddling out, you're feeling this tightness in the neck and shoulders,
Yeah.
and that goes into the low back as well. And that's been going on for how long?
Probably like more recently, like the past few years.
Okay.
Yeah.
So one thing that we'll do to kind of treat that is once we get you face down, I'll kind of palpate on your back
Okay.
and just feel out your muscles and your
Great.
spine and see how things feel under my touch.
Sure.
And then I'll decide what points we're going to use and what modality we're going to use to get you feeling better.
Great.
So nothing should be painful. Nothing should be uncomfortable.
Thank you.
I know you mentioned that you really don't like needles, and I
No.
tried to comfort you, stating that acupuncture needles are very small.
Yeah.
In addition to that,
Okay.
my style is very gentle, so you really won't feel much.
Great.
But I do want to make sure we're effective and you do see the results.
Okay.
So I think you'll be very pleased
Thank you.
after your treatment. A large part of acupuncture is your practitioner really trying to figure out what's going on and what's causing the issue.
Okay.
And one of the ways we do that is we take your pulse.
Okay.
So when we take your pulse, we're not necessarily looking for the rate, we're looking for the quality.
Oh.
Okay, so how your pulse hits my fingers communicates to me what's going on the inside.
Oh.
So overall, you keep stress levels fairly low?
Yeah.
Yeah, okay, good. So not very high stress, which is good. That'll help the digestive stuff. So I'm just going to push on some points here. Let me know if they feel kind of tender or ouchy at all. Not too bad? No, good. How about on this side? Not too bad? Perfect. I'm going to have you stick your tongue out, and I'm just going to stick your tongue all the way out. Thank you. So I'm looking for the color and the coating. Lift your tongue up. Perfect. Thank you very much. So when we look at the tongue, the tongue is a muscle, and it's the only muscle that your practitioner can see.
Okay.
Right? Every other muscle is covered. So it also gives us a good amount of information.
Awesome.
The color, the coating, the shape, all the grooves and cracks on there give us some info. So the first one we're going to do is there, and that's it.
Okay.
Not too bad, right?
No.
Is it what you thought it would be?
No. You do have a gentle touch.
Okay, good. So some of them you feel more, some of them you feel less. It really just depends on where I am and what I'm doing. These points that I'm selecting as well, they're very, they help your body relax.
Oh,
They're very relaxing points. So within a few minutes, you'll actually notice like, oh, wow, okay, I'm actually starting to relax. And what we're gonna do, we're gonna put these points in, and then I'm actually going to let you rest with them in for about 5 or 10 minutes.
Oh, great.
And then I'll come back and we'll take everything out and have you flip over and treat your back. And the back will be the cupping that you've done before.
Okay, wonderful.
Cool. So we had your front treatment that was mainly geared towards gas and bloating. And now we have you face down. We're going to do a treatment for that tight neck, shoulders, back. What I'm going to do is I'm going to first put some lotion on your back, and that's to really create a surface where I can slide these cups up and down if I need to.
Okay.
But we're probably going to put the cups on and just leave them stationary for you.
Sure.
But I'll always have that option if I did want to move them up and down. So what we do, just for our viewers, there are special glass cups that we use, and we put a flame inside of the cup. Flame kills the oxygen, and once we place that on a surface, it will create a suction, as you'll see here. So the first one you're going to feel is kind of in this upper right shoulder.
Okay.
And that's about it.
Oh.
Not too bad, right?
No.
Perfect. Second one is right below that one. And we only put it in there for a second, and again, you'll feel the thing. If the camera, I don't know if the camera can pick it up, but you'll see the skin being lifted off of the muscle in her back, which will give her some relief. And we're going to do that again on that left side. This helps with circulation. It helps with muscle relaxation. Does this feel different at all to the plastic ones that you've had done before?
No, not really.
Good, so it's about the same kind of sensation. We're gonna put some. And last one, you're gonna feel on this left side over here. Cool, so we get into low back. Now, the ones in your mid back, I'm gonna take those back up so we can bring them into the shoulder blade area.
Okay.
Kind of behind the scapula. So you may feel it pull. If it's too much, let me know, but we're about there with the right side, and there it is with the left side. Not too bad, right?
Mm-mm.
Great. So I'm going to let these sit for a few minutes, and then I'm going to bring all of the cups into the center, right above your spine. That specific channel in acupuncture, traditional Chinese medicine, is called the Du channel. Once the Du channel is affected, released, and there's an ample amount of circulation moving through that, it leads to a good amount of energy, heightened clarity, just an overall good feeling around the body.
Awesome.
Back up.
Okay.
To get some nice blood and oxygen moving through there. You okay?
Yeah.
All right. So you got some nice artwork here on your back. We got some nice coloration going on.
Oh, can't wait to see it.
Yeah.